Pearson, the host of Decisions Now, which is a podcast brought to you by Evaluator about how to leverage data and AI to improve your business decisions. Today, we're joined by two very special guests. We have Dr. Amelia Burke-Garcia, who is an award-winning health communicator and the director of the Center for Health Communication Science and Digital Strategy at NORC at the University of Chicago. Dr. Burke-Garcia's research focuses on innovation in health communication, particularly examining how social media and emerging technologies influence public health outcomes. And then we also have Dr. Rebeca Soskin-Hicks, who is a Stanford-trained and board-certified pediatrician and a fellow at NORC. She brings years of personal experience communicating health concepts with patients, as well as advising the development of digital strategies on health communication in big tech. So welcome, Amelia. Welcome, Rebecca. Really excited to have you both joining us today.
Thanks, Erin. It's wonderful to be here.
Thank you.
So just to jump right in, so your research traces how health communication has evolved from opinion leaders to social media influencers and now potentially to AI as well. I'm particularly intrigued by the paradox that you've identified in healthcare innovation. At the same time, you see like a prioritization and a fear. So looking at successful AI implementations, what unique challenges does healthcare face in this balance?
Yeah, thanks, Erin. That's such a great question to kick this conversation off with, I think. And I think to answer it, it would be helpful just to maybe take a step back and talk a little bit about my work and kind of what's led us here. Very quickly, there is the concept of opinion leadership. And opinion leaders first show up in Everett Rogers' diffusion of innovations theory. And that theory looks at how new ideas or innovations spread throughout a social network. And as some of your listeners may be aware, these new ideas spread throughout social networks along sort of this continuum. And at the very beginning of the adoption continuum are the early adopters. And on the other side are the laggards, right? The folks that sort of adopt innovation the slowest. And in the middle, there are some other steps, but there are also what are called opinion leaders. And opinion leaders don't just live at any one particular step or stage, but rather they're kind of strewn throughout, and they have the power and the potential to accelerate adoption. And the reason they can do this is because they have what's called prima facie credibility with people within their social network. And prima facie credibility is essentially credibility on the face or because of who you are. And that really has to do with the fact that you're considered trustworthy and knowledgeable about certain topics. And so people trust the information that you share with them about those topics. Opinion leadership has been used in health promotion programming for decades as a method of introducing new information. And there's quite a long legacy of successful use of opinion leaders to help drive adoption of healthy behaviors. And as our communications environment and our information environment has moved online, and with the advent of social and digital media, the barriers of time and space no longer exist the way that they previously have existed. And so now the opinion leaders in our world are not just the people in our physical social networks, but they are actually really anyone with a platform and a voice and a message that can share information with you that can be persuasive to you. And my own work has looked at this phase of opinion leadership. So specifically social media influencers as digital opinion leaders. And we've seen that they have similar attributes as more traditional opinion leaders. And in fact, when followers of social media influencers are exposed to health messaging from their influencer, there are positive, statistically significant positive impacts on knowledge, attitudes, beliefs, and behavioral intention related to various health behaviors. So similar to what we've seen in the past, we're seeing the same kind of powerful messenger in opinion leaders for people around health topics. This is the foundation of the work that Rebecca and I are doing together as we're looking at AI and advances in AI as sort of the next phase of this idea of digital opinion leadership. And which that brings me to your question around this paradox. because historically public health has not been the first to adopt. They have not been the early adopters traditionally. And I think that comes from a place of, public health, the intention is to protect people's health. And that is very much based on evidence and what we know from scientific studies and research. And those things take a little while. And so the adoption of new innovations, of new technologies, does not always happen fast in public health because we're waiting for the evidence. And so there's this tension between protecting people and not wanting to do harm with how do we actually test and use new technologies to reach people meaningfully with health messaging. I think with AI, we're presented with this very important challenge because AI is moving faster than any other technology that we've seen before. And so waiting for the evidence is not going to allow public health to take advantage of the opportunities that AI affords us, which I think we'll get into in a little bit, in terms of how we communicate about health with everyone, with the public. And so that is our challenge. That is the paradox, is how do we balance the need for evidence with the sort of impetus for engaging with AI technology now and really helping to build that evidence base, but you're building it as you're using it. And so that's kind of the work that Rebeca and I are doing together, but that's really the crux of the challenge that I think lies ahead of us.
Yeah, so it sounds like a lot like trial by action as well.
Mm-hmm.
And if I can just reiterate and add on to Amelia's statement there, that there are good reasons why advances in public health and healthcare fields are slower and more methodical around adopting new technology. And it's just because the stakes are so high when it comes to communicating about a person's health and their well-being. The risk of giving bad information or giving bad advice is very real, and it's a big risk. So I think that her point is excellent, that the thing to think about is that there's also risks in not making these leaps and advances, especially when the rest of the world has moved this health conversation into spaces that public health and healthcare providers are not. So I think about it kind of like the medical ethics principle of first, do no harm. While we want to ensure that our interventions with new technologies pose no risk of harm to the health of people, we also have to balance that with the reality that doing nothing can also be just as harmful, if not more.
Yeah, exactly.
Yeah, no, it is interesting to see how the risk balances out. So that actually leads into the next question that we have, which is really social media's influence on like vaccine decisions has revealed how digital opinion leaders can really have a huge impact on shaping public health outcomes. We've seen a lot of positive cases like the CDC's collaboration with influencers during the COVID-19 pandemic, and also more concerning trends like the spread of vaccine misinformation. So how do you guys see AI transforming communication, especially when it comes to reaching such diverse populations with critical health information, in particular to avoid misinformation?
Yeah, it's a really important and complex question, right? So just to put a fine point on what we're talking about here with a few data points, there are 70,000 health-related Google search queries per minute. And every day worldwide, there are 1 billion health and medical searches online. When you consider that, and then you consider the fact that it's sort of an inevitability that there would be both accurate and inaccurate information that people are therefore exposed to, the risk of sort of being able to understand what somebody's exposed to, or if they're hearing conflicting information or data, that's a challenge for people to navigate, right? And part of that, AI is part of that. So AI is driving both the creation and the spread of inaccurate information. And we know that being exposed to that kind of information is it leads to how people think about health decision making and the potential for negative health outcomes. we also know that that kind of information disproportionately affects communities that have been historically marginalized. And people are worried about it. 75% of consumers are concerned about AI-enabled inaccurate information and the broad spread of that kind of information. So I think when you take all of that together, but then you also consider that a lot of this is humans communicating, and humans are imperfect. You start to see that there are layers of complexity here, right? So as humans, if you think about that 70,000 or 1 billion number, we can't answer all of those questions. We just don't. There are not enough people, and there are not enough hours in the day to be able to respond to the number of queries that are out there. But more sort of kind of complicating it is the fact that we can't answer those questions, all of them out there. And we certainly can't tailor our responses to all of those questions to everyone's particular point of view or context or cultural nuance, right? Or linguistic preference. So we can't scale to that level, and we can't tailor to everyone's particular need. And then finally, as humans, we are just not universally empathetic. And even the best of us who can do this in an unwavering way, we still have bad days. We still have terrible things that happen in our own lives, or we don't get enough sleep, or we didn't have enough caffeine, or we hit traffic on the way to work, or whatever it is, right? There are just nuances to being human that make it very hard for us to just always be empathetic and caring about people's health questions or concerns. That AI can do these things, right? AI has the ability to scale to those numbers. AI has the ability to provide evidence-based information in response to inaccurate information or queries or concerns or confusion about what people are experiencing online. AI can provide tailored responses based on what it knows about the person that it's interacting with, and it can do so empathetically in a way that we just can't do. So AI has the ability to revolutionize how we do health communication, right? It actually is probably one of the best tools that we have in our toolbox as we think about the future of our field. And so on that point, just to sort of loop back to the sort of diverse communities part of your question, I think it is incredibly important when we think about all of this taken together that we're considering from the outset how these tools are being built, because right now there is a risk that we erode trust further, that we alienate certain groups of people or certain people with language preferences, or people who are uncomfortable in digital environments, right? Just from a user experience perspective. So I think we really need to be thoughtful and involve communities in the process and work from a place of inclusion so that these tools and what Rebeca and I are envisioning and building what we're calling health communication AI, it can work for anyone, anywhere, at any time, and it can be successful in that way.
Yeah, it's quite interesting to see what you can do with it, because whether it's, somebody prefers a voice, they prefer more direct communication, more empathetic, they need more explanation. If you're sharing something with somebody who's trained in medicine versus somebody who has no background in it whatsoever, you can describe it differently, and AI has that ability to personalize to people. So we're going to be getting into that more over the next few minutes. But for right now, the healthcare industry has traditionally relied on authority-based communication. It's really around the doctor-patient relationship and institutional credibility. But we are moving more towards a distributed and democratized health communication. So can you talk about how AI can bridge that gap between the institutional authority and the more personalized and accessible health information?
Yeah, so this shift that you're describing is one that I've been thinking about and working on for many years. And it started with the decentralization of medical and health information by search engines. And then it was accelerated by social media. And now it's again being propelled to new levels with AI. And I think that most public health and healthcare professionals can acknowledge that individuals having open access to health information is a really good thing, and that it can empower people to play an active role in their health. But the issue to reconcile is often that many individuals can't accurately interpret complex science, and they don't have the tools or the knowledge to determine the truth of a statement, even though they want to determine it for themselves. So at the same time, this institutional expertise and credibility that you're referencing, in many cases, it's not sought after or even trusted anymore. And so while many individuals don't have the tools for interpreting this complex science, they can often understand the concepts of personal risk calculation, and they want to be a part of shared decision making on all aspects of their health, rather than sort of the dogmatic, paternalistic approach that used to be, very prevalent in health decision making, where a healthcare professional just told them what to do. So this is no longer the norm. And I think the path towards bridging this gap is through education. And we can't really do it with the one-size-fits-all recommendations or education that public health has traditionally used. And they use those sort of one-size-fits-all recommendations for a reason, because it's hard to target the understandability level of a very large and diverse group of people. So there are good reasons why public health messaging has been that way, but it's not the path towards bridging this gap. And so education and delivery of accurate and empathetic health information when and where it's needed, which is usually on social media or other digital spaces where these digital conversations about health communication are happening. So to reiterate what Amelia mentioned, what AI solutions offer now is this ability to do this at scale, to have personalized, accessible health information brought to everyone in the spaces that they already are.
Yeah. And I really like that. And just to add on that, some of the research that you've also done in the past is how AI can also demonstrate greater emotional intelligence than human communicators in digital environments. It seems a little bit counterintuitive when you say it out loud, given healthcare's emphasis on the human connection. But can you unpack the research behind this and the implications for building trust in healthcare and with AI?
Sure. So I just want to start by saying that health professionals, both in public health and individual healthcare providers, are some of the most empathetic and caring people. They often enter these fields because of a really strong desire to help others. So the empathy is there, but they're human. And like all humans, they only have so much capacity for empathy at any one time. So especially when there's time constraints or conflicting priorities, I think it's no secret that healthcare providers are often rushed for time, and they're incentivized to be as efficient as possible. And so that's not always compatible with using high levels of empathy or really utilizing their emotional intelligence at the same time as they have these competing priorities. So on the other hand, LLM-powered chatbots can seem to have endless levels of patience and endless levels of empathy. They're not in a rush to get to their next patient or to fill other competing duties. I do think it's important not to anthropomorphize too much here, because LLMs do not have true empathy. They can synthesize it, though. They can synthesize the feeling and the meaning behind empathy. And some of them do it very well. So I want to particularly break down one research article that Amelia and I have looked at. It's by an author named Eliasef, and this was in 2023. What this group did is they looked at how ChatGPT performed on emotional awareness testing. So they adapted an emotional awareness test called the Levels of Emotional Awareness Scales, LEAS testing, and they found that ChatGPT performed at near maximum levels of emotional awareness. So ChatGPT almost hit the ceiling of this test, which is far better than any sort of normative population human scores have ever been shown. And so this test measures the ability to comprehend others' emotions and then express and comprehend one's own emotions in return. ChatGPT doesn't have emotions, and so the test had to be adapted. But essentially, the authors found that ChatGPT can just understand others' emotions and use emotional language and use empathy in their response better than any humans have ever done. And so there's one point that I thought was super funny in the discussion part of this paper. I don't know if you've heard of the Turing test before, but the Turing test is a test that was developed in the 1970s, and it's a test of a machine's ability for intelligent behavior. So the test involves a human examiner holding a natural language conversation with two concealed entities, one being a human and one being a machine. And then if the examiner can't confidently differentiate between the two entities, then the machine has passed this test, has passed the Turing test. So the funny part was that the study authors hypothesized here that if a human performed this test and could tell which one was ChatGPT, it would probably be because humans are unlikely to produce responses of such exceptional quality every time like ChatGPT can. So the implications here are big when you put together the evidence that we have for the importance of empathy and connection in health communication, and then the research that Amelia and others have done showing that this empathy is a key component to the success of social media influencers and of driving behavioral change. And then the possibility that LLM-powered chatbots can engage with individuals at unprecedented scale. When you put all of those things together, the power of this tool is really illuminated.
Yeah, no, that's quite interesting. I think it's the fact that you can actually look at it, that you're always looking for that more exceptional level of quality, and it doesn't get tired. And like it's always on, it's always on demand. Is a very, very powerful tool. So just to dive a bit more into the scale and personalization that we've been talking about, traditional health communication often looks at a trade-off between reach and relevance, which AI can potentially resolve this tension. So can you walk us through how AI can deliver both this mass communication and the individual relevance while maintaining the clinical accuracy?
Sure, I can walk you through that. And accuracy in health communication is something that I think about and work on a lot. It's critically important, both to prevent harm and to build trust with users. So in regards to health and medical information, accuracy is generally considered information that's aligned with the best available medical evidence, or sometimes accuracy can be judged against a medical consensus or another standard when enough evidence isn't available. But to truly judge accuracy, to judge the accuracy of a certain piece of information, you have to know everything about that information, all of the various investigations, experiments, trials, and studies, but also the historical knowledge on the topic or wisdom from traditional medicine. Another sort of complicating factor about accuracy is that it's not a static condition. It changes. I was listening to a podcast recently with Esther Perel. She's a world-renowned therapist, and she said, she sort of quipped or joked that in science, the truth of today is the joke of tomorrow. And I think that's an exaggeration to an extent, but the point is very real, that truth and accuracy evolve and shift through the discovery of new information. And sometimes this happens slowly, and sometimes this happens very rapidly. So outside of this judgment of whether a bit of information is accurate or not, there's also the important aspect of individual relevance. And relevance is affected by that person's context, that individual user's context. Who are they? What resources do they have? What risk factors might they have? Even what's their current emotional state? Like, are they going to be able to receive and process this information right now on this moment? And so when a doctor sits down with a patient in front of them, they're really putting all of these things together, kind of like in a matrix, where they're considering what is the best evidence that I have of a certain diagnosis or on a certain treatment, and then how do I apply this information to my specific patient in this specific context. And so early research has shown that LLM-powered chatbots have the potential to do all of this very well. Some Google research has shown that one of their chatbots routinely outperforms humans on measures of accuracy. And this just makes sense because an LLM can have encyclopedic levels of knowledge on every health topic, something that's very hard for humans to match, if possible at all. And so if the training data has been done well, and if it's regularly updated, LLMs should be able to surpass human knowledge on judging and delivering accurate health information every time. Even as the truth is evolving, they should be able to do this very well. I think what's really special is the ability for LLMs to tailor and personalize context so that the health communication, this exchange between a chatbot and a user, feels very relevant to the person. So the idea of this, sort of older one-size-fits-all mass public health messaging around a health topic and all of the struggles and ineffectiveness that comes with that just wouldn't be needed anymore.
Yeah. No, it is interesting. I think also just to draw a little reference to like House, the TV show. I just remember lots of episodes where, the key factor was what was the region that the person came from, if they had a tick or something on them, because that can so drastically change what the outcome would be. So it's very hard for any individual, no matter what field that they're in, to have all of that knowledge and just have it on hand. Whereas an AI actually has the ability to have those, as you said, encyclopedic levels of knowledge within all of this as well. So just to finish up here, so you've advocated for proactive involvement in health professionals and AI development. Given the speed of AI advancement and the deliberate pace of healthcare innovation, what concrete steps can healthcare organizations take now to help shape where this is going?
Yeah, the biggest thing right now is to lean in and participate, right? It is learn as much as you can, listen to podcasts, follow the trades, go to conferences, sign up and attend webinars, follow conversations in social media or subscribe to newsletters. There are a lot of folks who are super knowledgeable in this area who've been working and tracking a lot of these advances for several years now, if not longer. And it's really important to understand kind of who the players are, where the advances are, who's investing in which kinds of models or companies, and what are the trends that are kind of people are seeing on the horizon. Continue, just again, learn and lean in and learn and sort of absorb as much as you can for your industry, your field, your vertical, like what it means for the work that you do. If you're an organization, I would encourage you to support your staff in learning these models and tools and technologies, using them in your work. Create policies and guardrails, because I think that staff and people have a lot of questions around what can I do, what am I allowed to do. If you're a university or a college or another type of student-based setting, encourage your students to learn these tools, again, with parameters and guardrails. But we're seeing a lot of restriction in that space, and what we're doing there is not setting them up for success when they go to get a job. So support that kind of continuous learning. If you have the ability, fund research in this area. We need to be doing this work now. There was a New York Times article a couple weeks ago about a young teen who died by suicide after engaging with a character AI. We need to be looking at this now. Youth, adolescents, but also adults are engaging with these tools, and we don't necessarily know exactly what the impacts will be and what the right kinds of supports and resources for families and caregivers in school settings should be. Doing that hard work now so that we can be providing and iterating on those resources as this technology evolves and becomes more of our way of life and embedded in our lives is critical, so that we don't end up where we've ended up with social media, which is 20 years and we see the crisis. This won't be 20 years. This will probably, I mean, we're seeing it now, but we will only continue to see the impacts emerge over the next 6 months to a year to 3 years. So we need to really be investing in this space now. And then I would also say, if you're a tech company, engage health communicators in the process. These tools are not necessarily being built for health context out of the gate. They're being built for commercial purposes, which is, there's no problem. I have no argument with that. But when you talk about health and risk and what Rebeca talked about, first do no harm, we don't understand what the right benchmarks are for accuracy and harm reduction and empathy when it comes to health. And there's an argument that we can't produce harm, right? We shouldn't produce harm when it comes to health. So we need to be looking at those things, and health communicators can help tech companies design studies or input on use cases or gain community input so that these can be built for all people, not just sort of a subset of users. So I would say we need to be working across industry. We need to be collaborating, and we need to be continually learning and having these kinds of conversations in order that these tools can be advancing good in our world, positivity in our world, and we're reducing as much risk and harm as possible.
Yeah, I love those ideas. I think they're really actionable, really interesting. So I appreciate both of you taking the time to share your research and what you guys are both working on. I found it very interesting. So thank you for joining us today.
Thanks so much, Erin, for reaching out and for having us. This was great.
Thank you.
Thanks for listening to this episode of Decisions Now. Check out all episodes at evalueserve.com/podcast, and don't forget to subscribe for future episodes.